6 o'clock, and we're live on YouTube as well.
Hooray.
So if you don't know, I'm Bob Linde from the Tradition School of Herbal Studies, and we're here in sunny St. Petersburg, and we have both a Western and a Chinese herbal program here that's anywhere from little standalone classes on a Thursday or a Friday night that's open to everybody with a variety of our practitioners here and some of our teachers from the program, just doing little one-offs that are just a really good way to stay into things. We've also got anatomy, physiology, pathology for the herbalist. For those folks who are trying to get into the herbal realm, even if you're taking another program's classes, we encourage you to do that. 99.9% of all of our classes are online live, as well as in person. If you want to come over here to St. Pete, we usually have room for 25 people in the classroom here. And everybody who signs up for the class gets a recording. I know we have a lot of people who will go ahead and sign up and they can't attend during the live session. They'll get the recording no matter what, and then they can watch it at their leisure. I do that for conferences and things like that all the time. And besides, we have a Western and Chinese herbal programs that take you all the way from beginner, new herbalist, all the way through practitioner. It's one of the really unique things about the Tradition School of Herbal Studies is that we have an ongoing weekly student clinic here. We only do it in person for the clients, but for anybody who stays in the program, they can actually stay in the program and get their clinical herbalist certificate from us as long as they're showing up for clinics. They're able to attain it live online, and they're once a month. They're responsible for doing a case discussion where we write it up on the board and we work through each one of the clients. So it makes more sense. You can always check out the website at traditionsherbschool.com. Also, we've got a clinical practice here. We've got, I think there's 5 or 6 of us at this point, herbalists and acupuncturists. We're here 6 days a week. And thank you. I do need that reminder. We're here 6 days a week that you can come and see one of the senior practitioners here for either herbs and or acupuncture. We've also got one spiritual worker here as well who, oddly enough, has a master's in nursing. So she really knows what she's talking about and has finished all of our programs, does a lot of work with flower essences. That's one. She also teaches our flower essence certification course usually every year. And then what else do we have here? Oh, we've got a plant nursery. So we grow about 150 different medicinal plants that are potted up and available for purchase. Or if you want to see how they grow, we've always got them here in our half-acre teaching garden. Tonight, there's a little bit of craziness, so always something interesting going on. So tonight's our full moon market. So as soon as we're done with this, I'm going to go out and have some fun because we've got a drum circle, vendors. Also, Wednesday through Sunday, we have our tea truck out there. And then, of course, you can come in here Monday through Saturday, 9 to 5, and we've got a full apothecary here. It's always one of the fun things. If somebody comes in and says, like, hey, I need $1 worth of chamomile, we got you, measure it out. If you say, hey, what have you got for stage 4 cancer? We're going to say an appointment. So it's really important that we understand that nobody's giving out advice over the counter. This is kind of our big forum for giving out advice to the general public. And I kind of watch my P's and Q's, and I'm going to say this for the recording because I've already gotten blacklisted off a few sites. This is only for educational purposes, talking about the traditional use of herbs through the centuries, and is not meant as medical advice for anybody and their dog. But ultimately, ask your grandmama because she probably knew. I hate to say that, I think most people are smart enough if I tell you to drink battery acid not to do that. Promise I won't tell you to do that, although that is a cleanse. It's kind of permanent. But it is important because the algorithms go through, and if I say naughty words that are banned this week, they will put me on the bad boy list. So I'm trying to actually, at some point, I'm actually going to monetize these things, share this with everybody, and watch lots of stuff so that we can do good stuff. And I don't see the chat on here yet, and I don't know why. So if you're online, I usually can see chat. Yeah, I can usually see the chat thingy. So if you're here, which one? If you're here on Facebook, please give me a thumbs up or tell me you're here. and let me know who you are and where you're from, and give me whatever questions. Oh, shiza. I don't think I'm on here. So that might explain why. No, it's not. It's just Facebook sucks. Well, that's okay. You could reach. I think I know why. So it doesn't matter. It'll pop on here at some point, in which case, wow, that's amazing. So I'm going to talk to y'all since Facebook is dissing us tonight. Wow, that is so irritating. Everybody else is online, right?
Yeah.
Yeah. Well,
Wow.
so, all right. Well,
Did you click save changes? Oh, no.
Nope. It says.
It's weird. It's saying it's live. But,
oh, does it? Okay.
Well, up here, if you go all the way up.
Yeah, no, I know that shows it.
It's weird.
So, oh well. Somebody tell me you exist. And hopefully I will see stuff. But so far I don't have anything. So if you're not able to see it on here, go ahead and jump on YouTube, where theoretically it's working there. And I see humans on there. Yay. I'm sure we got bunches of other stuff here, but I'm forgetting to mention. Oh, classes, right. So I want to talk about just briefly, I got to finally teach at Medicines of the Earth that happens every year in North Carolina. I was really excited. The subject I got to talk about was hypermobility, Ehlers-Danlos syndrome. And I want to say in the herbal realm, I know there's one coming up in the American Herbalist Guild Conference coming up in 2 weeks, I think. So I would encourage anybody who has the opportunity. I'm not teaching that one, but the recordings just came out from Medicines of the Earth. So if you search for Medicines of the Earth, you're going to find the recordings up there. And I checked it right before the video. And I think it was $15 if you just do the recording, $25 if you get to see my pretty face. Honestly, there were some cool slides, I do believe. But, not to mess with them, but if somebody asked me, I'd probably share them. But without a doubt, I was actually listening to myself talk, which is very traumatizing. And it was a good recording. Like, they did a good job. They have professional stuff there. So there's also, I did one about food sensitivities. Starting as I mess with this foolishness here. There we go. I'm going to try to switch to my other. Put it on a hotspot and see if that works. That's worked in the past, so we'll see whether that allows us to start the whole Facebook.
I just put a comment too in the
event
to say to find us on YouTube.
So just search for Medicines of the Earth. It's super inexpensive, and there's tons of other really good classes on there from, I think, like the last 15 or 20 years. It's always, the location is one of my favorites. Yeah, it's so. I'm going to say a third of the time, Facebook totally screws this thing up. It's spinning wheel of death. So I'll talk to y'all. I see some stuff. I can't read those. I see some comments.
Hi, hello. Been receiving iron infusions for years.
Okay. So actually, I got a couple of other questions. I will stall on those because I love talking about iron. So one of the most important questions, iron infusions, like, they can be magical because they really get things squared away more often than not. But if you're continuing to need iron infusions, one of the most important, like, where's that blood going? And obviously, menstrual blood, if you have an extremely heavy cycle, fibroids, things like that, that can be a cause to regularly lose a lot of blood, honestly, to the point where you do need those infusions. So figuring out the why is really important. And one of the things, and if you've ever been on here before, I rant about a lot, is stomach acid. And so let me back up a little bit. There are two types of iron. There's heme and non-heme. So heme iron comes from animals. So if you're vegan, you're not eating that. And you're using the non-heme iron. And there is enough iron in vegetables. There's plenty of mineral-rich, iron-rich foods out there that are plant-based. But you have to work harder at it. The heme iron is definitely easier to absorb, where the plant-based non-heme iron, you just got to work a little harder at it. And so what becomes important if we're taking supplementation, besides the infusions, or just trying to eat an iron-rich diet, we need to look at those things that are interfering with our ability to absorb the iron. So the one I rant about the most often is tannins. And tannins are in lots of stuff, and you can always Google like, oh, all the things that have tannins in it. But the big ones are tea, black tea, green tea, coffee, and wine. Those are the ones we're most likely to be consuming and the most likely to interfere with our iron absorption. And it doesn't mean you're not allowed to have tea or coffee. You totally can. You just need to separate that. I like to do a minimum of an hour, but I prefer 2 hours of separation of the iron from the tannins. So that improves your likelihood of being able to absorb it. The other thing is if you're on acid reflux medications, PPI, proton pump inhibitor, an H2 blocker in particular, and even things that are just like antacids, like a Tums, those can directly interfere with your ability to absorb not just iron, but all your other minerals. And so trying to fix the reason why you're on those PPIs or H2 blockers, those acid reflux meds, is really important. The reality is I find that more people have low stomach acid than high stomach acid. Things like stress, aging, or a history of B12 deficiency or zinc deficiency can lead to us having a deficiency of hydrochloric acid, or our ability to break down our proteins and break down and absorb our minerals. Oh, you can have some of these too if you need them. I just want one. So there isn't a really good test for testing if you have low stomach acid. One of the things that we look for is if the acid reflux is caused when you eat protein, then it's more likely that you don't have enough acid. If you get acid reflux when your stomach's empty, then you probably have too much stomach acid. The other thing is a lot of, I've finally seen it like hiatal hernia if you've had children, overweight, lifting heavy weights, anything like that where you're bending over a lot. It's very common to have a hiatal hernia where, I got to sit up for that, where here's your diaphragm, my fist was my stomach, and this was my esophagus. Your stomach goes boop and gets a little bit above, there we go, little bit above your diaphragm, and that causes acid reflux. It's usually aggravated when you lay down in that case, in which case that's actually a structural issue, not an acid issue. And so not that I'm a fan of surgery. Chiropractors are pretty good at putting that back in place. But there is now surgery that allows for putting your stomach back where it is and not stapling it in place, but kind of stapling it in place. And that resolves the issue. So you no longer have the issue. So short answer is, figure out the how come, make sure that any iron you're taking orally through food sources or supplement sources, that you're actually getting the benefit out of it and that your stomach's doing its job of absorbing those things. So developing a hernia, a hiatal hernia, are you coming from the right from the diaphragm, or like one lower in your abdomen? Where's that hernia starting to come from?
It would be showing up as weakness around the belly button.
No, that is a true hernia, not a hiatal hernia. So if you're getting like a little bulging area somewhere in your abdomen, they usually happen at the belly button or below it. For men, it'll come, and sorry for you folks on Facebook, but I'm going to back out of this.
Do it from your phone.
I'm not even going to try to do that. Well, I'm not going to diss everybody else. So a hiatal hernia will actually come from, nothing will bulge. It'll literally just be likelihood. And the only way they can really tell is if they do imaging. So an ultrasound or any kind of MRI of your abdomen will actually show a hiatal hernia. And they can, even if they do an endoscope, they can do that. But if there's, and I think you said for for ages you've been doing that. You've been doing the iron infusions, and like that's scary that like you're doing those on a regular basis. Hopefully they've investigated why you're needing that, because that's not something like everybody gets behind, and you can have an iron deficiency that causes a problem, but really important that you see what's going on and why. And for anybody on YouTube, I'm trying it again, so we'll see if this works this time, or I get the spinning wheel of death. Yep, I still think I have the spinning wheel of death. So we're going to end up confusing Facebook. So never mind. I'll talk to y'all. So the hiatal hernia, it's more about the symptoms until they do imaging. So it'll feel like acid reflux. It tends to come right at the base of the rib cage, kind of somewhere around center. You may have some, oops, I got to stand up. You might have some, like, here's my ribs come up here to the xiphoid process, the little pokey downy thing. So it's usually tender right in here when you press on it. And anybody can have it, honestly. Anybody who's had a kid very likely has had it. And any kind of abdominal surgeries even increases the risk of it. So usually the biggies, and that's one, make sure your doctor's investigating that. And acid reflux would be the main symptom that you're going to get from that.
She said third generation
Of iron infusions. Well, that's messed up. And so there could be a genetic link. There's things like thalassemia, but even that would be an extreme. So hopefully they've actually tried to investigate some reasoning for that. There shouldn't be 3 generations of they never bothered. That's not a normal thing on that. Any other questions I got on there? I'm trying to. Why do I know that name? By the way, hi, Wanda. I know the mild hiatal hernia. Yeah. And they haven't any doctor. Yeah. Unfortunately, like they would say, like, nope, we didn't see anything interesting. And only if you read the actually report from the doctor and asked a specific question. For a mild hiatal hernia, they're probably just going to give you an antacid of some sort, an H2 or a PPI. For a mild one, I would actually consider going to a chiropractor for that. And I don't refer out to chiropractors a lot, but most of them have been trained on it. They're a little bit more aggressive than I am when folks are doing it. There's actually I could do this on camera. There we go. I'm a little crooked. I'm sitting on the arm of a chair. So here's my ribs coming up. There's my breastbone, and then there's a little hangy downy thing called the hiatal, the xiphoid process, which is a little tender, so don't press on that. So I'm basically, if I was laying down with my knees bent just to relax my belly, I would follow right to the center. There'll be a little tender spot, and I'm going to kind of like I'm comfortably digging in. I'm not pushing real hard. As soon as I feel like, oh, what's that? There's a little something there. I'm just going to go. Here we go. Boop. I'm just pulling down. Boop. Just like that. And doing that, honestly, as much as you can. Chiropractors, they're more aggressive than that when they do it. Nothing wrong with that. They're not going to hurt anything. Over time, that can actually kind of redirect or retrain your stomach to get in the right place. And the biggest tell is you don't get acidy burning stuff when you lay down. And so being consistent with it is going to be the most important thing. The sad statement is by the MDs just ignoring it and not addressing it, it's going to get worse, and which point they will end up, hopefully they would actually recommend surgery if it got bad enough. Yeah.
So there's 2 different people here.
Oh, okay. It's hard to keep track.
Yeah, the orange. So she was saying she doesn't have acid reflux, and that's the one that found a mild hiatal hernia.
Okay. Even better if you don't have any symptoms, in which case, if you're not on acid reflux meds and you have no symptoms, but they said it's there, you can just start doing that little bit of massaging things down. Be careful bending over and lifting heavy things up. Just kind of, when you instead, we all like to bend over like this. We're actually compressing our stomach and pushing it up. So making sure that we're bending with the knees, lifting with the knees, not the back. Everybody's heard that six different ways to make sure it doesn't get any worse, because we don't want that to get aggravated. And I would say mild's probably not terribly abnormal. It's not as scary as some of the stuff out there. And if you're just joining us, let us know who you are, where you're from, and type any questions in the various places, except clearly we don't see them to be on Facebook anyway. Down with Facebook. Sorry, I'll probably get banned for that, right? All right, we got a couple of questions that people sent in ahead of time, so I'm going to go ahead and go on those. We actually had a class last week. I was teaching a healthy foods class, looking at foods to eat based on the season, but through the lens of Chinese medicine. And one of the things, I don't remember why it came up, was gout that we were talking about in class. And we got an email a day or so ago that says, I totally missed what that herb was. And so there are a ton of herbs that can be helpful for gout. And the most important thing, if you are dealing with gout and have a history of getting gout, and the classic, if you don't know, gout is a increase in the uric acid crystals, and they're like, if you looked at them under the microscope, they look like little pieces of broken glass. They tend to go into the joints of the body. The most common joint is your big toe, and so the classic, this red, purple, dark, super painful, super hot big toe is 50% of the time that's where gout attacks you. That said, it can happen anywhere in the body. So it's not limited to the big toe. People can get it in their spine. They can get it in their hips, their knees, their elbows, their hands, you name it. And so when something acutely gets inflamed, where it swells up, it's super painful, seemingly for no apparent reason, but I would argue the reason is usually, and sorry, this is kind of my joke, but it's also the truth, salty cured meats with alcohol. So the combination of like, I just bought a pound of salami and rah, 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 and washed it all down with a good red wine, that can cause a gout flare up for a lot of people. And it's not, we don't see 12-year-olds, well, hopefully not drinking wine. We don't see 21-year-olds with gout very often. It's usually as people get into their 40s, 50s, and older that there's this cumulative thing, and it tends to be the people who've gotten it once are at higher risk of getting it in the future. They generally use the same medication, what is it, alpurinol, I think it is, that they've had since World War II. It works, but it does have issues potentially. Stopping eating those foods high in uric acid is the best thing. Less salty cured meats. They are linked to a variety of bad things like stomach cancer. And less or no alcohol is always a win. A lot of, I would say every culture has things that are good for that. The one that I used most often and I've had the greatest success with is celery seed. It's easy to get. It doesn't taste very good. Some people get it as a capsule because it's don't have to taste it that way. It works in a capsule. It works any place you want to use it. And so you can do a lower amount as more, you're like, I don't care. I like salami. I'm going to eat it anyway, or I want to drink my wine. And you're at risk for it. I would say a low dose, like 1 capsule a day, maybe a 1/4 teaspoon would be the equivalent of that. If you're like, oh my God, I had no idea, and all of a sudden your big toe swells up, start hitting that, I would say probably double the bottle dosage, or do it 3 times a day. Usually within about 3 days, you'll see a dramatic decrease in your symptoms. And obviously do silly things like drink plenty of water in order to get those crystals out. So gout's, it's one of those where I kind of get excited when I see it, especially if it's already comes to me diagnosed, so I'm not guessing, because ultimately you should have blood work. They can test specifically for your uric acid crystals with a blood draw. But when we see that classic swollen up, painful big toe, it's kind of a given. All right, I'm going to go off on a little bit of a weird tangent. So here's one of the great challenges in the world, and yell at me if anybody else showed up on there. So, and if you're just joining us, feel free to post your questions, and just out of our nosy curiosity, let us know who you are and where you're from. Ooh, wait, what's that? Oh, see, with my blurry eyes, I was like, I thought that said Moscow. And I was like, dang, we got somebody from Moscow. That's crazy. You win the prize. That's not true. We've had somebody from Pakistan on here. So and I apologize, Facebook, but I don't see any of you or your questions. So I'm going to ignore y'all and talk to these folks, these lovely folks over here on YouTube and Instagram, and we got them on your Instagram too.
Mm-hmm.
Anybody's wondering who this strange woman is next to me, this is Heidi. And what's your Instagram stuff? Give us your particulars.
Hayumi Ochisuki currently, but it's going under a brand redo. So it used to be formerly the Detox Dame. So
there you go. No,
moving away from that, it's a little too
check that stuff. Follow her as well, but she's my technical advisor among other things here, and helping us manage all the questions, because I'm used to only doing Facebook and maybe an occasional person here in the classroom, but now we have 4 cameras going on, and like, oh my God, it's too much. So one of the more interesting things is I'm allergic to cats. My mama was allergic to cats. My brother's allergic to cats. And this lovely woman here has 2 cats. So I don't get to visit. And it really is a challenge. Like I love all the animals. Cats are super cute and they're super loving. And I literally half an hour to an hour in a room with 2 cats. And I start itching, nose, and all that. And so there's a genetic link to that. So we were trying to find a solution to, like, oh my God, what do we do with these cat allergies? And like cats, dogs, and children, they're family. And so it's never fair to say, no, I feel like I'm cutting off this one camera. So
right.
I'm going to turn this way. Sorry, y'all on Facebook. Y'all lose tonight. And so to say, oh, you should get rid of your cats, that's just not fair. You shouldn't get rid of your children, your dogs, or your cats, and your lizards for that matter. So we started doing, or actually, I take that back. I saw a stupid Facebook video, and it was an allergist that I followed, because I'm always trying to learn new stuff. And he started talking about like this new information that was out there. So there are many reasons why somebody can be allergic to cats. And but most of the time there is a protein in their saliva that is the classic allergen. You can be allergic to other parts of it, but that's the classic thing. So what happens is when they groom themselves, the FeLD1 protein that they have inside of their system ends up on their fur and their skin, and then that sheds and it's in the house. And then I walk in, I go, I can't breathe. So it turns out, follow me if you can on this one. It's a little bizarre even for me. If you raise chickens, right, here in St. Pete, we're allowed to have chickens in our backyards, and you have a cat that intermingles and is in close proximity to your chickens will start to produce eggs that have a unique, I don't know whether it's a protein or an enzyme, that shows up in the egg yolk that will stop the cat from producing the FeLD1 protein, i.e. making it an allergy-free kitty cat for me. And so we found a local company that actually they specifically get it with this FeLD1 protein, and they have a bunch of chickens and a bunch of cats. And you've got one friend who now has 13 cats and is deathly allergic. I think her whole family is.
I think it's 19.
19 cats. That's too many cats.
Lindsay, we're talking about you.
Right. And so we've got a product now. We have it here in the clinic. I know, selfless promotion, but I find it fascinating. That I think it's a teaspoon a day it's a topper for the cat food. So you just
2 scoops, however much
So
or a scoop, 1 scoop per cat.
Yeah, one scoop per cat. Yeah, we made the mistake for the first 2 months of splitting it, and they were like, all right, it's a little better, but it takes about a month to start to see the benefits. And it's like, I probably should eat some too. No, it's just the cats have to eat it. And so they eat the regular food, just put the protein on there, the dried up egg. There are some other companies out there that make this product, but they're by Purina and similar types of companies where I didn't like the ingredient list. So with the company that we're working with now, we've got this in-house. It's a dried egg from a chicken that interacted with a cat. And I was like, I like that. I can work with that. So,
And you've personally noticed a difference.
we noticed a difference even when we were doing half dosage with the little boogers. Oh, we got a good question. All right.
This goes to it.
Whoa. Well, now that's a hard question. So let me see if I can. So, physical ailments, spiritual connection, and without a doubt, I'll talk that to death. What herbs and traditional practices might restore wholeness? And there is a great and there's not just do this and everybody will be magically ascend and be whole and happy and so forth, because each of us have our own unique imbalances and in this realm of spiritual. And my approach to herbs, dietary recommendations to whatever we're utilizing, and I would say even in spiritual practices, that we look at the energetics of the individual. And I got to remember, like, oh, these people haven't been following me for 5 years. So, so whether we're looking at Western herbalism or Chinese herbalism, Ayurvedic, and I would say all traditional cultures had a system of evaluating imbalances in the individual, and how we view herbs to give them, to create the balance that we're all looking for. And so in Chinese medicine, we say cool things like yin and yang and all of that, but ultimately all of these medicines from the traditional cultures from around the world, whether they wrote it down or not, it comes down to hot or cold, wet or dry, deficient, excess, and tense or lax. And we can be a combination of all of those things. It's in your office, half the people are cranking the AC down to sub-zero, and the other people are like got a heater under their desk and they come in all bundled up. We do that here too, by the way. And so to start finding what's the right herb for me, what's the right spiritual practice for me, it's so important that we ascertain, and not to say you can't do it on your own, but then you got to understand the diagnostic systems of one of those systems, whether it's Western, Chinese, and so forth. But to figure out whether if you're hot, like, oh my God, I'm always burning up, I'm drinking water. I was like, is that a lack of coolness where we need to add more nourishing cool things? Or is there an excess of heat that needs to be reduced? And it always comes down to like, what is it? Goldilocks. It was like, this porridge is too hot. This one's too cold. This one's just right. We're all looking for that homeostasis, balance. And so if we're contracted, we need to relax. If we're too lax, we need to tighten it up. And some of them becomes challenging to see the nuance on all of that. And within Chinese and Western and Ayurvedic, tongue diagnosis, pulse diagnosis, asking bunches and bunches of questions. I always say every time one of my students presents a case, they're like, what's the main complaint? What's their tongue, pulse, and poop? From there, we can figure out most of the issues. Like, yes, there's nuance, and we should ask more questions. Like, the questions are endless. And so trying to figure that out. And I will say, when people feel disconnected, and I'm going to say most are deficient and need to be nourished. And a lot of times, not always, there is contraction, there's tenseness. We'll oftentimes find some version of anxiety or sleep disturbance. Their pulse will be wiry and tight. The tongue is frequently red and either curled up on the sides or more pronounced red at the tip. And that kind of gives us some insight into it. And not to say that's always. I've seen people who are none of those things trying to find their connectedness to a spiritual process. And I'm going to say generically, time outdoors is one of the best ways to fix both physical and spiritual ailments. This evil device that I'm sitting here talking to you all on, so like, literally sucks the soul out of us. It sucks the life out of us. And so in our society, in the world now, it is a necessary evil, but controlling our amount of interaction with things that are just a bunch of electrons bombarding us and going outside and spending time. And I'm a fan of, I didn't know the term until like 10 years ago, earthing. I was like, no, I've been doing that since I was knee high. It was like, you go outside, you don't put shoes on unless you're walking across, sharp objects. Um, Spending time in nature is a part of it. But I would say finding your way to connect with nature. And like, I like gardening. So I'll go out if I have time and I don't have any patience, I go out and pull weeds. And it's just like, it's mindless. Every day before I come into clinic, and I'm, for all practical purposes, I'm here 7 days a week. Some days are long days, some days aren't. But before I start my day, I'll eat one leaf off of one plant. And I try to make that a different leaf. I go out all the time. It's so funny. Amita, our garden manager out there, she literally goes, she thinks I'm trying to tell her something or critique something. I was like, no, I'm just going out and looking at all the pretty plants. And I mean, I planted most of them and I've trimmed them and I've harvested from them. But literally at least once a week I go out. If you looked at all the pictures in my phone, it's mostly of plants and primarily flowers. And so it's about noticing what's around us. So getting outside and experiencing it. We're in Florida. It's hot here. I don't care. And admittedly, I don't mind the summertime. I don't mind heat, but it's like, it's uncomfortable sometimes. So you got to go out a little earlier or you go a little bit later so you can feed the mosquitoes. One of my favorite things and I tend to do it to the very hyper-focused kind of those type A people who need precise direction. It's like they want to do it right. And so it's like, you need to go outside and in 30 minutes, find 3 different flowers to smell them. And part of that's me laughing inside, but the reality is if we find 3 uniquely different flowers, we're literally stopping and noticing. In the process of finding it, we're starting to look at every blade of grass. We're looking behind the trees. And literally that connectedness to a greater whole, which is our environment, is one of the main approaches to this process. I'll tell a quick story in all of this, and I'm going to just ramble on. I've got a couple other questions I got to hit here still. I don't know if we got any more here. And for anybody just joining us, feel free to put your questions in the chat here, and we'll put them on the list.
That was the third part of your question.
Okay. I think everybody's life path should be playing with plants in some form or fashion. I'm biased, admittedly. I had a woman, and she was born deaf, and unfortunately I don't sign, so she brought somebody in to translate for me. And lovely woman, and unfortunately she was diagnosed with stage 4 cancer, went through chemo, radiation, did all this stuff. 6 months or a year later is like, yeah, we didn't see any progress. Go home, you're going to be dead in 6 months. And so she came to see me. And asked all the usual questions and got the answers, tongue and pulse. And we were doing some acupuncture because she had a lot of pain associated with her cancer. It had metastasized into a couple of areas of her body. And I was giving her some herbs, and it seemed like we were helping, like nothing had progressed. She was still alive 3-4 months later. But I didn't feel like I'd gotten the progression that I wanted. I wasn't seeing like dramatic improvement. It was like we stopped it in its tracks, so it wasn't progressing, but it hadn't like started to reverse itself. And so one of the things, whenever I don't get the progress that I expect, I'm like, I missed something. And as much information as I like to think I can digest, I forget to ask a question. I didn't interpret one of the answers correctly, and so forth. So I was like, we're going to schedule a little extra time, and brought her back in, and I just went through the whole intake again. And I was like, you know what? I don't know what you were doing prior to being diagnosed with cancer. And she was like, oh, I was caretaking for my brother. I was like, what was wrong with your brother? And it turned out and I never got all of the details, but he was very sick and in bed, and he passed away. And she was diagnosed with, actually it was lung cancer. My apologies. It was lung cancer. She got diagnosed with that a few weeks after that. And I was just like, wow, the connection of that. In Chinese medicine, we put grief, and I would say loss, as a association to the energetic, not your real lungs, but your energetic lung. And so I was like, what are the chances of you losing somebody um, that close that you had literally been, and then cancer shows up 2 seconds after they pass away? And I was like, did you get to say goodbye? And she was like, well, yeah, of course. I was like, no, did you say goodbye or did you just sign goodbye? She was like, well, I signed, I don't speak. And so a lot of times for people who are born deaf in particular, they never really are able to form the vocalization. And there's sounds that come out of their mouth. If you've worked with anybody who's born deaf, that there's sounds coming off, there's excitement, but it's not always, they're not always able to articulate the words the way people born hearing can. And so I was like, I know this is going to be weird, but the emotions trapped inside your lungs, you need to speak and get it out. And I was like, nobody needs to hear it. And so I literally was like, go out in the woods, tell a tree, wait till everybody's gone from the house. You don't have to be outside. I don't care. And like she came in twice more and she was like, I can't do it. It's too weird. It's very uncomfortable for her to try to vocalize anything. And like to take a thought from your head and have it come out, even though she knows it's not forming the words the way she wanted. She comes back in, like, I think it was like the third time. This is now like probably 2 months later. And I was like, well, how you doing? And I kind of like, I knew it was a sore spot, me hassling her about like, oh, we got to say this stuff out loud. So I kind of like waiting for it to come up naturally in the meeting. She's like, I'm a little sore and tired today. And I'm like, oh my God, the cancer has progressed. I was like, oh, I got to start asking harder questions. I was like, why do you think you're sore? She's like, well, I pressure washed a mile of fence and stained it yesterday. And I'm like, draw job. She was like, I did what you said. I finally did it. I told the tree. And I was able, she was like, I felt this weight lift off of me. And I haven't seen her since then, but it was at a year mark. She was supposed to have been dead. She went to her oncologist. They were like, nope, nothing wrong with you. And her numbers were good. They wouldn't redo imaging to see if the cancer was still there or not. And at least in my mind, she's still alive. But the importance of how emotions can affects us and our ability to speak truth out of our pie hole. And I think pets are, you can tell your cats, you can tell your dog, you can tell your lizard. But I'm a fan of telling trees. I think, when we have a lot of oak trees here. So I frequently tell people to go out and talk to an oak tree, but whatever the biggest, most powerful old trees are, trees hold the memory of millennia. And we literally build shelter out of trees, right? We take lumber from that. We build roofs. We build walls. We burn the wood and it gives us light and heat. It protects us from predators, especially mosquitoes. And so here's this super powerful thing that literally grows everywhere. And we walk by it and we don't say hi. We don't say hi to grandmother, grandfather, tree. And we don't share our feelings about what is paining us. And I always say, the tree can take your grief. It can hold on to all the things that bother you. And so, I tell people to go out and find a tree that speaks to you and tell it what's going on. Nobody has to hear you. And getting that off of you, out of your chest, out of your body, so it no longer affects us. Because it's funny. It was one of the questions. So coming around, how do emotions, like they physically affect our digestive system? Emotions affect our immune system. Emotions affect our sleep patterns. And so why would we hold on to that crud? And so you pay a counselor, you can use Claude. There's lots of options, right? Trees are free and don't have an effect on the environment other than positive, because you're giving some carbon dioxide for it to produce oxygen in return. Like, what a wonderful thing. And I would say, sorry, I'm still answering your question, whether believe it or not. If you were to go to a counselor, you would pay them money. If you talk to Claude on the AI, you're giving up a piece of the environment. If you go to give your struggles, if you give that to a tree, bring payment. That payment can be one of the very classic things with the indigenous people in North America is tobacco, but cedar's also used. It can be something important to you. It can be blood. It can be hair. It can be menstrual. You don't have to cut yourself. Don't do that. But it can be menstrual blood. Honestly, plants love pee. It's full of nitrogen. There's like good stuff in your pee. It also wards off some insects and predators oftentimes. So bring something a plant can use. Don't bring $20. It has nothing to, it can't go down to 7-Eleven and buy a Slurpee. So bring something that has benefit for the plant that you are asking for help with to take on your burdens. And that brings me kind of around ceremony is important. And so when we are, and it's my favorite example because I like coffee. That's on my list to talk about too. So I like coffee. I start my day with that. I wake up and I grind some beans. I measure it out and I put it, I got like a little espresso machine at home. So packing it in and putting it in there and setting the dial and making my perfect cup of coffee. And there's a smell and a preparation. I honestly, I don't like to talk until I have my cup of coffee. And so it's literally through this very specific, repetitive action that I do every single day. It's how I greet my day. And is coffee good for you? Probably not. I don't put a bunch of crap in there. I'm not piling in the sugar and the dairy and all that kind of stuff. So I keep it very simple. I like the bitter flavor. I enjoy it. Obviously, I like caffeine. But it's a ritual that I do every single morning before I start my day. And so creating ritual, and it doesn't have to be some large involved thing. And it's a ritual that we can do to start our day, to end our day. And that could be a meditation. That could be a yoga practice. That could be anything that we create this structure in our life as a way to start and end your day. We can do it with other people. People go to walking as a group. And so that's something we can do with our community. You can do it with your loved one, a family, but not just do it. Like if you're driving through Starbucks, that's not ceremony. I just need a cup of Joe then. But when we add intention to it, and so our herbs, see, I can bring it back around. If we're using herbs for a spiritual connectedness, it shouldn't be just like, oh, let me just take that pill. Let me just throw that in some water. Like, no. Think about what you're doing. Carefully measure what you're doing. If you're like, yeah, I don't have the, then if you're going to take a tincture like an alcohol extraction, literally make your own. Ask somebody like, I need these herbs in this proportion. Learn how to make it. Because when we make a tincture, it's literally, I don't have a container. Oh, well. Oh, wait, there's a container. Let's say we were making, this is dealing your drink. Ooh, it's funny colors. So let's say we were making a tincture out of this and we were going to do a 1 to 5 tincture. See, it's medicine making class. We would fill it with 1/5 of the container with whatever herb or herbs that we wanted to do. Then we top it off. A lot of times you're using alcohol, like 100 proof vodka, depending on the plant, blah, blah, blah. We can put different things, but just generically, we can say that. Or tea. We can do the same thing with tea. But when it's a tincture, we shake it every day. And so what is the purpose of your tea? We say those words of like, this is to help me sleep better. This is to give me more focus during the day. And we shake it a little bit every day, saying those words out loud, creating the intention that we want in that tincture. And depending on who you ask, 2 weeks to 6 weeks later, we strain it off. And then we take a very carefully measured amount. And again, it would depend on the herbs and the intention and the age and size of the person who's taking it. But all of that is ceremony intention that takes it beyond an herb that has these chemical constituents. I mean, that's important too. But the intention helps you connect that spiritualness. So I'll rattle off a few herbs that will help. And this is important to remember as well. Herbs, if they're doing their job, you don't take them forever because they're supposed to correct stuff. They're correcting the imbalance. So ultimately you might take a particular herbal combination for a week or a month, and then you stop taking it. If I was catching a cold today and I took some elderflower and yarrow flower, chamomile, made a really strong tea out of it, I would take it until I would release the exterior diaphoresis, break a sweat. And then I would feel better the next day. I don't keep drinking it. I'm done with it. I fixed the problem. I had an excess. I had a bunch of viruses or bacteria. I corrected it. I'm done with that. Now I should work maybe on my immune system. Why did I get sick that time? So if we're working on our balance, our spiritual balance, or our physical balance, we say, what do I need today? Put those together. Check to see if it's correcting the imbalance, because maybe we made the wrong choice. And then over time, we're like, oh, that's better. I probably don't need this. Now you change your formula. And so constantly trying to improve ourselves, striving for homeostasis, for balance, is part of a spiritual path. Because, depending on your belief system, like theoretically, if you actually were able to achieve that, let's go with Buddhahood. Now you ascend, you're done. So it's like, no, I want to keep working on it because I'm not done. I'm still trying to improve myself. For me, I'm odd. I don't know where I got this from, but since I was a little kid, I'm constantly trying to improve my environment, and part of that is the people in it. I literally, it wasn't a nonprofit because it wasn't registered with anybody, but I think I was 9, living in New York City, 77th and York, and there was the delivery street that was kind of the crappy street, and it's where we liked to skateboard because nobody knew what that was then. And I literally decided, this is gross back here. We need to clean it up. And I managed to corral like 3 of my friends. We went around and got money from the apartment complex we were in for us to go out and buy push brooms and flowers to clean up that street. And it's like, no, that's about affecting my immediate environment. And so how do I affect that physical environment? How do I affect the people who interact? How do I affect the animals in that? To create that nourishes me. And so knowing how you're going to constantly strive for your improvement is oftentimes your environment creates it. You strive to create a place where you can do that. If you're like, I want to meditate, we create a space. I want to be balanced and be spiritually strong. We exist here. We exist in our home, in our office, in the city, the county, state. How do we create balance there? It returns the favor. So if we, things that I like, I'm a little ADD, maybe just a pinch. So I really like some herbs, and it's funny, they're Ayurvedic herbs, even though I'm not a big Ayurvedic guy. Both of them have the common name Brahmi. And if you study in Ayurveda, in a lot of the spiritual practices there, Brahmi is like the highest god in the process. So anytime there's an herb called Brahmi, you're like, ooh, that's a really powerful herb. So go to Cola, Centella asiatica, and I would say Centella sp, i.e. any Centella species will work. It helps with focus. It reduces inflammation in the brain and allows me that clarity of thought and understanding in order to do things. And I pair it specifically with Bacopa montanari. Both of these grow wild in Florida. And the Bacopa, admittedly, I'm not a fan of the taste of Bacopa. It's pretty nasty. It's important that you get it from a safe source because it is kind of this pond marginal plant, kind of grows in marshy areas. So you don't want cyclospora off of it, or my new weight loss plan. Eat more lettuce from Taco Bell. So the reality is I pair those two. The Bacopa is moistening and cooling, and the go-to cola is a little bit more drying. I wouldn't even say hot or cold. So if I'm phlegmy, which I tend to be, I do more of the go-to cola, and I just kind of back it up with the Bacopa, which is this relaxing, focusing herb. So the two together work really well. If I was getting anxious over it's got this thing coming up, like recently, I wasn't anxious, but I was a little obsessive. Getting ready to teach at the Medicines of the Earth conference. I was so excited about that. Like, I've been going there for 20 years as a participant. And I was like, this is super exciting and a little intimidating to be going there. And I know there's a lot of doctors and nurses and lots of naturopathic physicians there. And so I was like, all right, I'm talking to a different crowd. And because I spend a lot of time talking about energetics, that doesn't resonate with everybody. I was like, I can say medical words too, but I'm like, the way I practice is through this concept of energetics. So probably for the month prior, I was a little bit of a pain in the butt about that. And so passion flower, another Florida native, is a plant that's great for anxiety, but it is specific for this idea of circular thinking, ruminating about the same thing that can keep us awake. And it's funny, even though passion flower has nothing to do with sexual function, passion flower comes from the description of the flower itself, Passion of Christ, crown of thorns, all that kind of stuff. So passion flower, I'm seeing way too many 25 to 45-year-old men who are having to deal with erectile dysfunction, not because their testosterone or their blood flow is messed up. They're anxious. Their performance anxiety. And so that herb literally helps them get out of their own head and stop circular, that hamster wheel kind of thought process that all of us do for some reason at some point. So finding the right herbs for that, for the really hyper focus, obsessed, like I need to list and I cross everything off. And as soon as you change the plans, I lose my crap. The blue vervain is a wonderful thing. So how do we get into this place of focused intention, but outside of our relaxed norm, I think is huge. As we, everybody's probably had their heart broken at some point. Western medicine now recognizes broken heart syndrome as a physical ailment. So we can use rose, we can use hawthorn as a way to heal the broken heart that allows us to feel whole and balanced and things like that. So really identifying those things. Cacao, I love cacao for that. It's so funny. I had somebody came in, we were talking about cacao in some class, and they were like, yeah, I had a really bad reaction to cacao. I was doing this ceremonial cacao, and I was like, yeah, no, you shouldn't have had a bad reaction. I mean, there's a little caffeine in there and stuff, but it's paired with L-theanine and heart opening and all that. It was like, sometimes, not everybody needs the Band-Aid ripped off to open up their heart and all. Like, no, sometimes it's like, why don't we just let it leak out a little bit at a time? It's a little kinder and gentler. And so what they didn't know was that for most cacao ceremony that people use from Central South America spiritual practices, they usually put a little cayenne pepper in there or some other hot pepper. It's a nightshade. And so they didn't know they had a sensitivity to nightshade. So this adverse reaction, heart racing, anxiety that came from all of that had nothing to do with the cacao. It had nothing to do with the ceremony. It had to do that they were basically not having an allergic reaction. They were having a reaction to this companion plant that was put in there. So it's part of it is like, know yourself physically, energetically, and spiritually what your needs are. And that moves you to that place of understanding from physically within, emotionally within, energetically. And it's funny. I'm a fan of counseling. I worked in that realm for a little while. And there's lots of people, me included, went to a counselor for a long time. They're like, I don't even know what I'm doing here except for pissing my money away. Didn't feel like I solved any problems. I didn't feel like I got any better. And what it was is they were saying the right words. They were giving the right tasks, but I wasn't in a physical, emotional, or energetic place to receive the information. And so I talk about this all the time to my students. Is like, are we fixing their mental, emotional issues? Maybe, maybe not. But we're creating balance in their body so that when they're ready to go to counseling, when they're ready to deal with all of their crap, that it's easier for them to accept it, make the changes, to do the change in behaviors, whatever it is that they need to shift in their life to be happy. it's so much easier than the other 27 times I went to a different counselor and tried a different magic trick. It's about creating a balanced terrain in order for change to happen. Boy, that was a long ass answer to that. I don't know whether any of that made sense. Sorry, I'm just ranting off about stuff. There is no magic herb. All the mushrooms in the world ain't gonna get you there. Much fun as that might be, that there is no shortcuts to a spiritual happiness.
You've got a comment here more. It just says, thank you for your lifelong commitment to the well-being of the community.
Thank you. It makes me happy to do it. All right. No other question. Man, you guys are being kind or mean or something. I don't know. I'm just spouting off. Ooh, I got to do a quick station identification. If you don't know, I'm Bob Linde. Hey, I appreciate y'all. Sorry, Facebook. Y'all screwed me again. Not the people, but the organization. It crashed. So we're trying to expand our reach here and all the other things. You can find out more about the school, traditionsherbschool.com, and follow us on YouTube. Yay. Probably already are. Or the clinical practice, AcuHerbals, AcuHerbals.com. We're here in St. Petersburg, Florida. Although I don't do online consults, a lot of the other practitioners here do. I can safely say now that everybody here has studied at least 2 years with me, and all of them have been in practice for more than 5 years in total. Some way more than that. We've also, like, if you're in the area, I always encourage, please come by. We have a half-acre medicinal garden. We've got a plant nursery back there, tea and coffee truck with blends that I created myself, that's open Wednesday through Sunday. There's lots of cool classes that are both online and in person. I feel like I'm always forgetting something. Ooh, there's a cool class on pet stuff coming up in October. It's not on. It's online. You can find it. And I don't have it here either. For those of you who are herbalist, acupuncturist, massage therapist, Trisha, the director of the school, we co-teach a class on physical assessment for the herbalist. And it's so funny because I don't consider myself very good at that. So every time I do it, I'm like, ooh, I pick up an extra skill or two. And so she was an athletic trainer back in another life, worked for an orthopedic surgeon doing all of his evaluations for, I think, 5 or 6 years. Then taught anatomy and physiology for both college and high school. And she got tired of the public school system. So we suckered her into coming to work here. She's been here for a number of years now. And we kind of co-teach this one. She goes through the physical assessment, and then I look at herbal or acupuncture or acupressure approaches to each one of the ailments that we look at identifying, and some really basic stuff. And so very appropriate for anybody who works with humans from a physical or energetic standpoint. But in Monday night, we've got a student clinic here 3 nights a week. And it was actually, no, it wasn't Monday night. It was Wednesday night. And one of our clients came in, and it just happened to be the practitioner is both an herb student here, but also is an acupuncture student soon to graduate, Kevin. And it was a client we'd seen many times before. And he comes out and he presents the case, and he's like, yeah, she was out gardening. She took a fall, and she's got a ding on her head, and she scraped up her hand. I was like, did she go to the doctor? Because, like, no, acute injuries, you should go to the doctor and get them to evaluate you. He's like, no, she didn't like doctors. Like, we're like, fine. So she just wanted to deal with some of the bruising and acute trauma that she got from that. I was like, cool. And so we go in, and it turns out the accident was yesterday or Tuesday. And so less than 24 hours since she'd had this pretty serious fall. And so she had a ding on the side of her head that was probably about the size of a golf ball, raised up about 1/2 inch. And she was complaining about a headache. And so it was like, that could be a concussion. It could be a bunch of things, but at the very least, a concussion. So we did a quick little check for eye reactivity and so forth. And we were like, all right, I'm pretty sure she doesn't have a concussion, no nausea, no confusion. Her memory seemed right. Nothing coming out of her ears, equal and reactive eye reflexes and all that. So I was like, all right, probably fine. And I was like, show me what you did. And she had a little bruise on the side of her leg, but she had like kind of fallen off to the side and dinged her hand. I was like, oh, and this woman was 78, I think. And so I was like, okay, that doesn't look too bad. I was like, can you move your fingers? And she was like, yep. And she's like, jazz hands. So cool. I was like, elbows okay? She goes, yep. And she just like humoring me, literally. She was just like very entertained and like, this is stupid. I'm fine. Just give me some herbs. And then I was like, okay, so now show me your rotation. And then her shoulder went pop and scared the crap. We all kind of stared at her, waiting for her, we all heard this sound. And we're not doing imaging. We're like, you need to go and get an x-ray, because what we find is a lot of times when somebody falls or has any kind of an injury like that, even though this is where we see it, this is what hurts, we get gravel and road rash on our hands, the act of falling, especially as we age, that energy transfers up, and we see a lot of collarbones, shoulder joints that are damaged or broken, that they don't really notice until all of a sudden they can't. And we also checked, she couldn't raise her arms up properly. And so that's why it's good to be able to at least do physical exam, and not that we have to like, oh, now we got to do some crazy thing. Certainly not as an herbalist. We're not manipulating tissues, but we can say, does that hurt? Does this, can we run through our range of motion? Can we turn our head left and right? Not only can we ascertain like, oh, I don't like that, you should go see a doctor, or we can see whether the herbs we're using, we can use herbs for both acute and chronic injuries to great success. My students, Western and Chinese, all learn acupressure. We were working at an event last night, and someone was like asking us questions about something else. She's like, oh yeah, I got this bad crick in my neck. I was like, show me. And so we ran her through her range of motion. I was like, okay, it looks like it's got a little hitch in your giddy up there. I was like, let me borrow your hand. And we just went and pressed small intestine. I compared 3 to 4, but her small intestine 4 literally was and I was like, mashed on that. I was like, now show me your neck. And now she had full range of motion and no pain. And so slapped a magnet on there, and she was happy and went back to, she was exercise instructor of some sort. And so now she can go back to work without any injury. So our ability to do physical exam and know some really basic stuff is super important. So for any of you who are in that realm, that's a fun class. Sorry, I digress. But I like telling bad stories. All right, let me go with our other question. Oh, we did cat allergies. It's funny. I'm going to talk about coffee, because we kind of started off talking about iron infusions and things that are stopping us from getting our iron to absorb to the levels that it's supposed to. And I also just said, I love coffee. It's my ceremony in the morning. It's how I greet my day. And now I'm going to tell you, coffee is terrible for you. We all choose our poison, and we take herbs to help mitigate our bad behavior. It's not terrible for you. There's absolutely nothing. There's actually research that says it reduces your rates of colon cancer and a bunch of other benefits. It's a nootropic. That's the hot word for the last 10 years of making, pinky in the brain, that my brain expands in size because I'm increasing blood flow to my brain. Sure. It's good for that. I will say I'm quite sure that it is has a negative consequence for men, but I'm not sure what it is, other than maybe keeping us up at night. And remind me to come back and say something about that again. The reality is, for women, I'm going to say half the time, don't hold me to that number, it is the culprit in menstrual stuff. And it's one of those things that, if you don't know it, you switch ovaries. It's not always a perfect rhythm, but if like, oh, this month my cycle feels really good, and the next month you're like, oh my God, I'm dying, it's because you switched ovaries. And so sometimes there's like a little crimp in the ovary, that for some reason it's not getting the right blood flow. It's not excreting hormones in the right way. So one will be great, the other one will be a little wonky. So I always say you need to wait 3 cycles to see if a particular thing that you're trying is doing any good when we're trying to improve menstrual stuff. It was one of those things where I was like, fibroids sometimes have a relationship from an energetic standpoint with Chinese, we'd say qi stagnation with phlegm. Western, we just say it's a tense condition. And like, we can get a little irritable, a little wound up, too much coffee. We're like, so that's happening energetically inside of us as well, and creates things like fibroids sometimes. So an ex of mine actually debilitating, gonna lose work, menstrual stuff. And I was like, hey, we tried everything else. Let's try this stupid coffee. Stopped coffee within 2 cycles. Didn't even it normalized, no fibrocystic breasts, no more painful menses, no PMS. And for 6 months, she was like, this is heaven. I'll give up my coffee. And then she went and had 1 cup of decaf. And I think this is important. Because we associate caffeine, which is one chemical one alkaloid in these 10,000 chemicals that make up any plant. And so 1 cup of decaf, and all of a sudden, all the cramps, all the pain, all the PMS came back at 100%. And so it really let us know that in her case, at least, it wasn't the caffeine. She could have all the tea she wanted. It was something magical inside that bean that was causing things to stagnate. So for anybody dealing with fibrocystic stuff, fibroids, PMSE, and nothing's quite worked, and you really love coffee, it's worth trying, and just give it 3 months and you'll see. But don't switch to decaf. And so I will say there's a product that's been around for a long time, Ticino, that's nice, and it keeps the ceremony of coffee. You still measure it out. It has that nice roasted aroma. It's got a number of different herbs in there. You can get one like the vanilla roast or whatever. I don't do those. But I'm totally going to put out, I lost my glasses again. There they are. I'm going to put out one of my graduates. I'm so proud of her. Jana created a product. It was actually our Western students have to make a product for National Herb Day and do a presentation about it and stuff, and make a product for sale. And so she got herself off coffee, and she created a herbal product in order to do that. So I'm going to put it out on the mass. Coffee with a K. And we do have this here. We serve it in the coffee truck. But the mushroom coffees are all the rage. I think that the fruiting body of the mushroom is way more important than the mycelium, despite all, I love the mycelium remedy and all that. But this got reishi, cordyceps, lion's mane, chaga, chicory, cacao, yay, cacao, and then a blend of adaptogen herbs. She's got Siberian ginseng, we said that, ashwagandha, rhodiola, and moringa. So it's got some nourishment to it as well. And now I'm going to tell you how bad a behavior I have. I actually put that in my coffee. So when I make coffee here at the clinic, I'm just like, no, I want the best of both worlds. But she has a whole protocol on her website. Let me see her website. So no, buy it here. Her website is Z, like the letter Z, Plant Magic. I assume it's a .com. But she actually has videos and talks you not only how to make her product, but how to taper down off of your coffee. There was, I think it's been 2 years now. I decided it was kind of my birthday present to myself, even though it was before my birthday. I was like, you know what? I used to work with the Eckerd Foundation for severely emotionally disturbed juvenile delinquents in a wilderness camp. We'd build log cabins and do these 30-day canoe trips. And the canoe trips in particular were this fascinating thing. We saw this change in progression with people. We saw this group of sometimes rough bunch of kids. All of a sudden, the cohesiveness and their ability to function and accomplish and have time left over for fun and all of those things. The 30 days on the canoe trip, when we took them even further out of society than even the 800 acres where the camp was such a interesting group dynamic. And I was fascinated. I was like, what would happen if we did that as adults and not quite as challenged as these kids were? And I never did it with adults. But I was like, you know what? I really want to see what happens if I do that for myself. And so kind of started to hit the bucket list kind of thing. And I was like, I always wanted to go and paddle the Swanee River from the Okefenokee Swamp in Georgia and paddle downstream. And it was hard for me to take off enough time to do that whole river. So I was like, you know what? I'll just do 100 miles. I'll do 7 days on the river, and arranged to be dropped off out there. And about a week before I left, I was like, something feels wrong. You know, I was like, going by myself, that's fine. And got my camping equipment. And I was like, it's too easy. I know I can paddle for 7 days, no big deal. I was like, I think I'm going to do it without food. And I'm going to wildcraft and catch what I can. And I was like, well, maybe I should bring a fishing. I was like, fishing rod, that's too easy. I was like, I'm going to just bring water. And I was like, yeah, but I kind of going to miss my coffee. So I brought coffee with me, and I brought a pot and things like that. And so I want to say at the end of I think it was either first or second day, I was like, you know, it's a little chilly out here this morning. I was like, I'm going to make myself a cup of coffee, and I made a little fire and started to make some coffee, enjoyed a cup or two of coffee and jump on the river. Terrible night's sleep that night. And so I was eating just green stuff. I didn't catch any animal proteins or starches until like the last 2 or 3 days. And so I had coffee twice. Every night I just put a hammock up. I didn't bother with a tent at some point. I was like, I'm too lazy to set it up, and there's no need. There was no bugs. And so I slept so good. I was asleep an hour after sunset. I woke up right at sunrise and just like refreshed, clarity and everything else, a little hungry. But those nights that I had coffee in the morning, 1 cup, maybe 2, slept horrid. And so I was shocked because I had no supplements. I had no nothing. And when I got down to it, that little amount of caffeine affected me. And of course, you know, after 2 weeks, I went right back to all my bad habits, just like everybody else does. So detox for
Cats with skin inflammation.
So it's funny. I will say for most mammals in general, so cats and dogs being the ones I work with the most of your skin things are coming from their food. And so cats in particular, I hate to say, you can Google this, the amount of protein that they're supposed to have. Cats belong eating way more protein, usually in the 80-90% protein. And when we start to look at the ingredients on most of even some of the better, like, oh, you know, I got the best Purina offers kind of thing. Usually 3 of the top 5 ingredients is from a grain, and a grain that they would never eat, and processed meal and all kinds of weird things. And especially over time, those foods usually cause some version of inflammation in the and finding a gentler, kinder food will go a long way. And without a doubt, there's herbs that will help. So cool if you can make food. Most of us don't have time to make food for our critters the way it would be nice to do. But as protein heavy of a food as you're able to get for the critters, the better. And it's without a doubt, we can add herbs to that as a general rule. And it's funny, Western and Chinese kind of agree that what we see in our skin is a reflection of what's going on internally. And so the 2 things that we find, or the thing that we find is mast cells and histamines, the inflammation that we see from eating inflammatory foods, and grains for dogs and cats usually equates into a primarily inflammatory diet. It starts to express and the hair falls out and so forth. So we can help that with antihistamines, anti-mast cell kinds of things. And so stinging nettles is an easy one to give to cats that helps with histamines, helps humans with histamines too. So if your allergies are acting up, you can drink some stinging nettle tea, and you can just grind it up and sprinkle a little bit onto their food. And burdock root. Burdock root is specific for mast cell stuff, and really knocks down kind of at the root problem. But the most important thing is to change their food. And it may even like, no, for real, you're buying the best food. It may be the wrong protein. And so there are a number of proteins that can be used, but when we look at meat stuff and we're like meat, protein, fat, and like all things have fat and protein. But the reality is we all know that if you eat venison, that's going to respond differently from a fish, right? It feels different in the body, even though they're both protein and fat. And so I think it's really important that we look at the protein that we're using, even if it's the best food in town. And as a general rule, if we see skin stuff coming out, that's heat from an energetic standpoint. Okay. From an energetic standpoint, and we want more cooling meats, and so whitefish specifically. And so a lot of people get confused when I say whitefish. I'm finding that out. And that's literally the color of their flesh. And so, and not that you got to give your cat grouper because the cat's not going to make it. That's too expensive. But if you like salmon, tuna, when you cook it, the flesh is darker. It's kind of got an orangey reddish tint to it. Where if we did a flounder or a grouper or snapper, that's a white color fish. And so when we look at whitefish, we're literally talking about the color of its meat. And so whiting, cod are the two most common ones I see added as a whitefish to cat food and dog food, and is the least inflammatory to the body. And even though, like, from a flea standpoint, they're hyper responding to those flea bites. Sorry, that was for anybody who didn't see it. They're like that skin inflammation is from fleas. And so looking at why is the skin overreacting, that is about internal environment and inflammation. So finding with something with a whitefish, and here's the worst part. So not whitefish, heating in general is salmon, tuna, anchovies, sardines are all a dark colored flesh. And so those are very common. And I won't say those are bad for you, but for somebody who's already hot and inflamed, those will actually aggravate it. So switching to that. I've heard there are some other mammal proteins that can be used. I'm less familiar with kangaroo and rabbit, but I have heard that those are also a possibility. Any of the birds generally, other than chicken. Chicken, for whatever reason, is inflammatory to dogs and cats both. And she does wet and dry. The
Protein's the first ingredient.
Oh, nice. So that's like probably a decent one. You just may need to change the protein to something less inflammatory. A lot of times you can get nutritional yeast and add that into food if there's fleas as it's one of those things when I'm feeling really healthy and I've got all my nutrients and my foods are fresher, everybody else is getting eaten alive by the mosquitoes. And I'm like, whatever. If I'm not doing everything I'm supposed to, which, that's been known to happen, I will be devoured along with everybody else by the mosquitoes. They'll seek me out in the daytime, forget the nighttime. And one of the things that there's a couple of nutrients that we exude it through our skin, and it tends to reduce our attractiveness to things like mosquitoes, in this case, fleas. And it's mostly B vitamins and sulfur. And B vitamins are coming frequently from the protein, so that should be good. The nutritional yeast is higher in B vitamins, B6 in particular, which tends to be a good insect repellent. And sulfur compounds come primarily from fresh vegetables, like literally just pulled out of the ground. And so, okay.
Too strong. It was too strong.
The brewer's yeast versus nutritional yeast, they're similar, but like not a lot. You just put a smallest amount and doing it. So if it's too strong, like, no, I'm not eating this crap. Cats are funny. Cats think you're trying to kill them. And so it may have been like, no, it's too smelly. I'm not eating that. Actually, your cat thought you were trying to kill her. And so literally, I always joke, I don't have a good, if this is here's your cat food, and here's the whatever you want to put in there herb wise, you got to start like a foot away. The next day you move it a little close. Next day you move it a little closer, and you're like, touch it with your finger, wipe it in the bottom of the bowl, and then put the cat food on top, until they actually believe you're not trying to kill them. A lot of supplementation, changing their food gets really challenging. And just some cats are like, yeah, whatever it is, I want to eat it. Your cats are just chowing down. We throw all kinds of, we put weird things in there. The other thing is to, minimize the flea exposure topically. I'm always challenged by the diatomaceous earth. I don't like putting diatomaceous earth outside just because it's there, but any indoor bedding on the floor, carpets, putting it out there, and you can dust your cats with it. Internally, it's not doing much of anything, but it's literally they're microscopic little diatoms, fossilized diatoms that have sharp edges. And so anything with an exoskeleton that walks by it will literally, it slices their exoskeleton. They kind of dehydrate and die. And so, but the trick is getting it everywhere. If you put it outside, then we're killing beneficial insects too. So I always like, but indoor bedding, play areas, and so forth, getting that out there as much as possible can go a long way with it. And it's usually some combination of all of those. But depending on what your protein is, you might look at what the protein is to help reduce some of that inflammation and there's always a few fleas running around. Changing the reactivity of the cat will make the biggest difference. It's so funny. I knew the term. I had one of my students actually we didn't know it until we started delving. She was allergic to everything, nightshades leading the parade. And she had a really cool condition called dermographia, where she was so allergic to everything. She was allergic to life. She could literally just take her finger and write her name in her arm, and it would all red and raised because her whole body was reacting. It wasn't that she was allergic to her finger. Her insides were so inflamed from these food sensitivities that she had. It expressed through there as allergies. And so if you have a cat that's hyper responding with weird skin rashes not to say that fleas are inevitable, but if the cat's going outside occasionally or something like that, it's going to pick up some fleas. Summertime, I assume, is the worst time just because they don't generally live very well in the wintertime, even in Florida. So she's hyper responding to what I would call a kind of normal stimulus. And so really changing the responsiveness, the burdock and nettles, but the food can have a really impact. And, kudos to you. You're doing better than most folks are with the food if protein's the top thingy on there. But now just look at what's the energetics of that protein on there.
What about that idea of, like I was talking about with fleas, when the cats will eat the fleas? They're really good at eating them. And our holistic vet was like talking about that, and she's like, "Oh, they're good at eating them, but then when they eat them, that's actually how they can get tapeworms. So if they have tapeworms inside the body."
So it's one of those things where the actual parasites in the body are very real. It's funny. I think it's important to identify the actual type of parasite. Tapeworms, obviously, they look like little segments in the poop. And so it's like tiny little segments. I'm trying to think of a good example of what looks like that, almost like tiny little bamboo, but kind of a grayish white.
She says yes, tapeworms.
Oh, yay. That's a whole nother issue. And then pinworms, and there's species specific pinworms. Like there's a cat one and a dog one.
Orzo.
Orzo. Oh yeah, orzo. Pinworms look like orzo. I always wonder what grows the rice.
The tapeworm little.
Oh yes,
little chunks,
they can.
Yeah.
So obviously sending a poop sample out to get analyzed for what critters are in there, because what we need for a pinworm is different from what we need for a tapeworm. And we don't want to use anything so toxic that it not only kills the parasite, but also the host, your kitty cat. And so I think it's really helpful to be able to ascertain that. as a general rule with tapeworms, because they've clamped on, like the important part, the head is attached to the intestinal wall. So we need to get them to relax and let go, as well as moving some poop out. So a lot of times you end up with a little diarrhea in the process for all the critters, humans included. But knowing that, like, oh, we got a tapeworm, we got to get something to let go. It's funny, I'll use kava for that. Kava, you get your cat a little high. Jamaican dogwood is decent for that. Those tend to be my biggies specifically for tapeworms, but always a combination because the other ones are more killy. Epazote is, I've used that on everything from humans, horses, dogs, and cats. And I really like the epazote. It grows wild here in Florida. So if you're a Florida person, it's literally, this is the season. It's out there. We got a bunch out in the garden. It's a little smelly, but generally very safe. I like that. It's used for a lot of different, I always talk about pinworms with that, but as I looked at it, like, no, it has a long history of whipworms, pinworms, and a bunch of, I think even hookworms. And so that works. I tend to go, the black walnuts, helpful, wormwood and artemisia. With those two herbs, we have to be careful because those are hard on the liver. And so when we're working with cats in particular, too aggressive, they're not able to process out some of the stuff in there. So really paying attention to dosage when we talk about tiny little critters with tiny little livers that have to process all that junk. And also making sure that the poop is coming out, especially when we add herbs, and it's very easy that they get a little constipation from all of those issues. A lot of people use hot peppers. I don't do that to critters in particular. They end up with a whole different set of issues if you're putting cayenne peppers and things like that. So I tend to use with the more classic things. I do use some classic Chinese herbs as well. It's so funny. I don't do a lot of parasite work, and for whatever reason, most people won't get their actual blood work. And but this past week, I had 2 people with parasites, intestinal parasites, very likely. And they also both had Lyme disease, so that's more of a bloodborne parasite. And so I use a Chinese herb. I'll make sure I can remember it. There's 2 that I like. There's a whole slew of them, but Shilu P. I don't know if you want to type those in.
She asked.
It doesn't kill them. It makes so kava doesn't kill the tapeworms. It makes them relax. So it's an antispasmodic. That's the cool part of it. And so that's why you have to have the formula. You need something that's killy and a little poop moving, but you need something to make them let go of the intestinal wall. Killing them usually isn't enough. So these 2 Chinese herbs, the Shilu P and Fates, sorry, I don't remember the Latin names on those off the top of my head.
This guy says it looks like Kameme El Kulo. I don't know if that's what he's
I-
saying or if that's...
I'm not sure. I don't know that herb, so we might have to Google that one. I gotta
I
find
could
the
have said
Latin name on
anything
that.
just now.
So yeah, like
And what were these for?
these are both antiparasitics for a variety of things. So one of the things, and I see humans doing this more than I see animals because we have to give it to the animals, is humans when they're doing parasite cleanses, too often they do them forever. They do cleanse after cleanse after cleanse, and it actually, it may have killed off the parasites, but it actually starts to damage the host. We're not using soft, gentle, happy herbs when we're trying to kill something. So it kills off their gut flora, it destroys, they're frequently drying and purging, and so it creates a lot of deficiencies in the body. The 2 Chinese herbs that I really, and I would say the epazote is also gentle and yet effective, but the Shilu P and Feitza are known to be antiparasitics, or specifically in that herbal category, but they both preserve the qi. So they don't damage spleen qi, yet they're gently moving stuff out. So I think it's really important to always balance your formulas so that you're protecting the host, but also get something that's specific to the type of critter that you got. So I don't put kava in everything.
Wesley says he found rosemary, wormwood, thyme, and lavender to be effective for this, but tapeworm is another game, but cats don't get pinworms.
Oh.
Carry or transmit, yeah.
So it's all, yeah, tapeworms are a pain. And it's sometimes, mine's name is Elroy. One of the things that's important is that's why we get a poop, because and there's so many different types of threadworms and whipworms and hookworms. I don't think are in some critters. So every critter has a different life cycle, a little different dosing. We also need to find the source for it, so that we also destroy that area. Like, are we cleaning their bedding? Are we cleaning their favorite play place? And making sure that that they're getting diarrhea after they do a flea treatment.
Mm-hmm. Chemical or
not
natural.
Good. So if it's a natural treatment that's doing it, a lot of times those are using essential oils for the topical and or internal ones. And I don't think cats should ever be exposed to essential oils. They're not capable of and even small dogs, I'm not a fan. Birds, never. And so that may be taxing the system dramatically. I'm not and it's always tough when the regular veterinary chemical flea things. It's funny, if I was using a topical flea stuff, or if I was doing a chemical flea thing, I would probably be more prone to do the internal one than the external one. The external ones, so often we're not controlling the dosage, and there is absorption through the skin. When you're putting those on, they frequently contain essential oils that are really hard for a cat to process. And I've seen a lot of harm done from essential oils to cats. And so if we're doing the internal V stuff, there are many problems with that as well. And I'll give you Bob's generic answer to this. Like, I've seen horrible nervous system weirdness happen from the chemical flea stuff. I always say go down one dosage or one size. So, like, sorry, I know my doggies better. Let's say it's a 20 to 50 pound dog, and here's the flea stuff for them. Take it to the next smaller size down. Cats, you obviously don't have as big a range. If it says to do a whole tube of the whatever the juice is that they put on your neck or whatever, making sure that they can't reach it to lick it is important. Getting it on their skin, do half a tube. Don't do the whole tube. So you're reducing, and if it's not enough because, the fleas are still there 2 weeks later, you can always add more on. But if you put too much on, and their body can't process it, because everybody's a little different. And like, if they're getting diarrhea from that, they're having an adverse reaction. Like, if it's like, I put the flea stuff on and they poop everywhere the next day, that's an adverse reaction. And I'm like, don't let your critters suffer. Like, it's like, and so I don't discourage people. I just say, let's see if we can find the minimum effective dosage. And if they're having an adverse reaction, finding a different brand, because they're all a little bit different. A lot of the chemicals are the same, but they're usually neurotoxic. And if you're doing it topically and it's causing that reaction, that's a pretty extreme reaction. So I would say, like, either it's just the wrong product and finding a different option, or dramatically reducing the dosage to try to still get the positive effects from that. And hopefully that diarrhea is not going on for more than a day. I don't have any other good answers for that other than like, that's not good. It's tough that and I don't think one brand is better over another, or one chemical approach that is better than the other. I've seen my share of critters in here with adverse events associated with that, that monthly flea thingy or and so forth. And obviously, it sucks because it's flea and tick usually, and dogs get Lyme disease and it destroys them the same way it does for humans. The going down a dosage, because I see a lot of neurological issues coming from the dogs. It does affect the nervous system. It can affect their organs. And so really like the safest minimum dosage on anything. And I would say that about every drug. And ultimately that is a drug. And so just being really cautious with that. Yeah.
When they get out of their system, she's tried pumpkin.
For pumpkin seed for antiparasitic, or just pumpkin because and no, it's really good for animals in general.
Yeah, I would guess just like a puree.
Yeah, pumpkin puree. It's a very gentle thing to use on dogs and cats. They generally love it. And humans actually, and babies. It's very soothing to the digestive system. That can be really helpful. Making sure it's been cooked, I think, is important. You can also add some of those anti-inflammatory herbs into that. The nettles and burdock can be ground up into a powder and mixed in with something yummy like that. Because it is, not to say all acute reactions are mast cells, but the reality is most acute reactions are mast cells, and that will help to minimize the response of that. But in the same sense that cat's digestive system is saying, hey, get that crap out of me, literally. So modifying it's good, but also trying to address the thing.
He says iron should be taken with C to aid absorption.
Oh, going back, yes, to the it's funny, and we'll circle back around. It's good to take it with C, but you shouldn't need C with your iron as a supplement. Most supplements, good supplements, have it put in there, but it's ascorbic acid is what vitamin C is, and you should have hydrochloric acid in your stomach. You need the additional C if your stomach acid's not sufficient. So any acid will do, but it should be a hydrochloric acid at a pH of around 1 or 2 in order to be able to process that. And I'll put a caution on the vitamin C. I had somebody, it's funny, it drove me nuts. I couldn't figure it out. She was a Linus Pauling high-dose vitamin C person. And she was doing, I think she was doing 4,000 or 5,000 milligrams of C daily, broken into like 2 doses. I was like, man, I'd be pooping myself at that dosing to do it daily like that. I'm like, holy crap, literally. And she ran out and she went to the whatever health food store and bought a buffered vitamin C. And she got all the way up to 8,000 milligrams of vitamin C, and it didn't do anything. It didn't, like, she actually started to get constipated. She's like, I don't understand. And we're like, buffered, i.e., they added an antacid to it. They add calcium to it, and it made it so that it was no longer doing the good things that she needed. And she was taking twice the amount of vitamin C and getting none of the benefits she expected from it. And so I figured out really fast that, like, that's not good. So making sure, like, I like the bioflavonoids and there's thousands of different types of bioflavonoids, but some sort of bioflavonoid in with your vitamin C or ascorbic acid. But ultimately, totally value added to add to the iron. But if you need to, there's a problem with your stomach acid. That's really important to remember.
We were just talking about that with why would vitamin C give you stones?
Oh, yeah. The calcium and the vitamin C. Yeah. I saw something else on there. Sorry, I can't read it.
Thank you for your videos, sharing knowledge. I'm forever grateful for sharing about Gotu Kola.
Oh, yeah. No, one of my favorite herbs. It was really fun. We were working an event last night. There was a fundraiser to raise money to support the folks in Venezuela recovering from the earthquake. And kind of a last minute thing. I was like, we'll support that. We donated some stuff and went down and we vended there and brought a couple of plants just to, it's like a lot of times when we do those events, we're not really trying to sell anything. We're just like information. Here's some fun stuff. We brought a couple of plants and one of them, just because it looked good, I grabbed some ashwagandha and this guy who was from India, and he came by and he was like saying, oh, the importance of Ayurvedic and going back to nature and connecting with our roots and all of that. And he was like, he was on a good rant and I was with him on it. Like we were all over it. And I was like, he kept mentioning Ayurvedic medicine. I was like, you know what that plant is right there? And he was like, oh my God. He called a friend in India and was video showing him that. And I was telling him, I was like, no, you got to come by the clinic. He's probably outside. I got to go out and see him here in a few minutes. We're almost done. So last chance for questions. But I was like, you need to come by. I was like, we got Panornava as a weed here. We've got Gotu Kola. We got Bacopa. We got Bala. There's so many herbs that grow, Ayurvedic herbs that grow. And I got a big neem tree. I gave him a neem chew stick. I don't have any here. So he was very excited. I'm hoping he comes by. We were geeking out, even though he was a software designer rather than an herbalist, but it was part of their culture was about utilizing that. And all of us, it kind of goes back to one of our first questions here. All of us, as we live online doing this crap, as we work under, artificial light, it's dark out and yet it's still bright here. It's magic. We stay over connected to these stupid things. We get exposed to, color printing. All of those things get us, forget the microplastic, all these things that are hormone disruptors and sleep and our various cycles in our body, but it gets us further away from our connectedness of nature. And so, yay, go to cola. Just go out and find it. You don't have to consume it. Just the process of us spending time in nature makes such a dramatic thing. And getting back to those cultural roots makes a difference over time.
So we've got this one, but real quick, the lady with the cats, she said she's was doing the pumpkin for the digestive, but she's also trying probiotics too.
Oh yeah, probiotics is always a win, and there are obviously specific cat probiotics to make sure that those suckers get in there.
Oh, you got two good ones here.
Ooh, do tell.
Do you see children with cerebral palsy, epilepsy, and neurological disorders in your practice? I live across the bay. I've always wanted to bring them to see you.
Oh yeah, please. And student clinic or daytime clinic, it's funny. We're going to magically cure it? No, but the epilepsy, and obviously with CP, epilepsy is a common add-on fun challenge for you. And I'll say, yes, please do. I wish I could say there's a magic herb, although Gotu Kola would probably show up in that. And looking at, oftentimes in the extreme, sometimes something like CP, where energetics show up more clearly in something like cerebral palsy than you would think, because we talk about tense, and so that contraction, the spasticity of some of the limbs and the muscles and the movement within the realm of Chinese medicine. I really think it's a beautiful connection, because we see a lot of digestive upset, we see a lot of phlegm, food reactivity, and so muscles specifically relate to the digestive system in Chinese medicine. And so I think that has a lot to do with it in there to improve the digestion, to reduce the inflammation, will minimize ideally, some of the severity of that. And I'll also say with CP, acupuncture would probably not be a nice thing and not sustainable. But acupressure can have a huge impact on somebody doing that on a daily basis, that as the parent, I assume I'm talking to, can really make an impact there. And I would say that any of the practitioners here, more than capable. I'm sometimes a pain. I am taking new patients still, but sometimes it takes like a month or two to get in to see me, just because I don't have enough hours in the day.
How much stinging nettle and burdock should she give the cats?
So for you kind of have to do some math, but as a general rule, a human 150 pounds would do like 2 tablespoons would be our dosage. And so titrate down to the 10 or 20 pounds. So probably like a quarter teaspoon would probably be the right amount.
That's about what I was given mine. Yeah.
I mean,
Slow
nothing.
introduce.
Slow, steady, and see how they respond. And I would say about the same with the burdock. And there was a second question.
She says thank you. She'll definitely reach out soon. And the other question is, what herbs have you found best to treat fatty liver?
Ugh. So important to differentiate between alcohol-related fatty liver disease and non-alcoholic fatty liver disease. It's still fatty liver and still screws things up. The easy answer, and boy, how much time we got? No, this might be the last question, unless it's an easy one. So I'm a big fan of milk thistle. In general, there's actually some decent research. So I teach at the local acupuncture school, and one of their homework assignments, I guess it is, was to read a research paper. And feel free to email at traditionsherbschool@gmail, and I can send you a copy of the research study that is specific about milk thistle seed for non-alcoholic fatty liver disease. Now I'm going to contradict myself. It was in the 1950s and 60s that they started to do a standardized extract with the silymarin, which is this, they say, active ingredient. It's a marker compound unique to milk thistle seeds that isn't in some of the other thistles that they did research for. For thousands of years, the Greeks and other people used the leaf and the root of milk thistle and generally didn't use the seed because it's such a pain in the butt. And every culture uses the thistles for liver and gallbladder stuff. So as a cholagogue and a hepatic. And so I would argue I would rather use the other stuff, or if you have a native thistle that grows where you are, use that sucker. That said, it's more convenient to get a milk thistle seed. If you do, make sure it's standardized amount of silymarin, whatever. Usually it's 80% silymarin is kind of some of them will go up to 90, but anywhere in the realm. And it's a slow, steady thing. One of the things I talk about for its liver / gallbladder hepatic cholagogue is artichoke. And everybody forget, like we just had some artichoke the other night. It was like, I don't think I've actually made artichoke with dipping it in the butter and the oil. Like, that's not good for you. But boy, it tasted good. But we made artichoke. And so artichoke, the globe, is the flower of a thistle and has all of the benefits that any thistle will provide you. Here in Florida, we've got bull thistle and sow thistle. Those can make a tea out of them. They can actually be cooked and consumed. The bull thistle, I'm sorry, I don't remember the actual Latin name, but they're pretty easy to identify with all the spiky things on there. The root can be consumed kind of like a bitter carrot, has great benefit. I'm a fan of okra, specific for fatty liver disease. And I really like hawthornberry for fatty liver disease. There's obviously seeing where any individual is important, creating formulas around it. But those are a lot of my go-tos for fatty liver disease. Obviously looking at, alpha lipoic acid. Almost forgot that. Alpha lipoic acid also has benefit for it from a supplement standpoint. But ultimately looking at how come you got it, what are the other imbalances so the body works better, and look at the long game for that. So fatty liver disease is one of those things where you didn't get it overnight and you're not going to fix it overnight. So really think like, this is what I do every day. And it's funny, I never was told I had fatty liver disease, but I have hemochromatosis, which is too much iron. I didn't know it. And so I ended up with a stupid high amount of iron. And it wasn't until I started to get symptoms. And when they first did imaging on my liver, they're like, damn, you look like a drinker. I was like, I'm not. But it was, I forget what the stage is right before you get fatty liver disease, non-alcoholic fatty liver disease. And I almost completely reversed it. So getting rid of the excess iron that was in my body. I was using milk thistle and a couple of other Chinese formulas that matched my pattern, but it was alpha lipoic acid, milk thistle, and a formula designed for me. I used to enjoy a glass of wine probably once a week. I haven't touched a glass of anything in 2 years, at least 2 years now, because I was like, oh, heck no, I don't want to deal with that crap. And so all of those things together have gotten it where technically you can't reduce it. No, my size, inflammation, and numbers have all but the size is now reduced to normal. So it is possible, but it's taken me 3 years of work on it and just making sure I'm doing all the right stuff for it. And it's funny, and watching out for those things that challenge my liver. That it's like here in Florida, I don't really understand it, but they were like, oh, you can get Amanita mushrooms. I was like, well, that's weird. And I asked the people, and I was just like, super cool. And I'm like, I'm curious. And I bought some, but I didn't take it because I was like, I know that this is a toxic mushroom. Let me go and it specifically is processed through the liver and toxic to the liver. So I was just like, here, I gave it to a friend. I was like, I'm not touching this because I didn't want a chance doing harm to an organ that I consider kind of important, and I don't want to ding it any more than necessary. And there's lots of things that we do that challenge our liver. It is responsible for breaking down all of our nutrients, processing all of our toxins. So if we need to put a little extra effort to it for all of us, because our livers are doing some hard ass work these days. All right.
You do have one other.
Okay.
It
One
says,
last question.
with so much info on the internet, I'm stumped at where to dedicate my attention and truly learn how to be an herbalist.
Come see us.
Yeah.
This guy, I'm biased.
Yeah.
I will say that there's different ways. Like if I'm like, no, screw this, I want to be a clinician. I think you need to find somebody, and like, he's the best. No, go someplace where the person teaching you has a clinical practice where they're seeing clients. And ultimately, I can flap my gums at somebody all day long, but the only way to learn to be a clinician is see clients. And so there are maybe 3 herb schools in the country that have ongoing clinical practice. And I think it's important to seek one of those out. Some of them do it online. We don't do ours online. We do clinical practice online, but we don't see clients online except for when our remote students present a case. So we're not like doing the Zoom consult with any of our clients. Like, I don't think the students learn that way, honestly, because they're not able to do a pulse in particular. But find those schools, and the best place to find an herb school to go through is the American Herbalist Guild. And so American Herbalist Guild, it's like AmericanHerbalistGuild.com. I don't remember what their website is, but Google that, it'll come up. I'll also say in like 2 weeks is their conference. It's in Asheville. But on the AHG's website, there is a list of schools. They don't certify a school or anything like that. Hey, if you pay the $100, you get to be listed on the website. In theory, all the schools on their website, we sign a contract, a piece of paper somewhere that says that we will abide by their standards, which basically it's like, here's what, for somebody to be a clinical herbalist, you ought to learn a little botany, some anatomy, physiology, and pathology. You should learn you should have a system to evaluate people. And it can be a medical system, like, oh, let's get some blood work and do a more functional medicine kind of thing, but use herbs. It can be Ayurvedic, Chinese, Western herbalism has an energetic system through the eclectics and others. And so I think it's really important to go through that system. And that's to be a clinical herbalist. It's like, I want to have some fun with plants and make some medicine. then there's a million programs, the one that you gravitate to the individuals and so forth. If you're like, I just want to take care of myself and my kids a little better, I love Rosemary Gladstar. Honestly, her program is, although you can go further with it, I think for that grandmother's medicine, that day-to-day kind of dealing with stuff that what everybody used to know, and when there wasn't a CVS on every corner, I love her stuff, but there are lots of other people besides her that I think are great. But American Herbalist Guild is a great starting place. I think it's good to go to a conference. The level of excitement at the American Herbalist Guild conference, and I would say any herb conference for that matter. We have a Florida herb conference, but it's very isolated because there's not like schools from all over the country there. And you're limited to just Florida teachers there. But the energy of all the people who are there are super excited about herbs and want to share everything that they know. Like, don't ever tell anybody you have a headache at an herb conference, because everybody's like, they want to do something to help you in 2 seconds. You're like, shut up, too much advice. I'm going to go have a glass of water. But it gives you a chance to see teachers, and they're frequently the teachers are associated with a school. So you're like, I like the way this person presents this stuff. You might like the way they present ideas. You like, I really like the medical approach. I like the chemical constituents approach. Like, you're not going to get a lot of chemical constituents from me, no matter what class. Or you're like, I'll say an occasional word, but I'm like, that's not how I practice. It's important, especially when we're talking about toxic substances. We should be able to talk about silymarin. We like cyanotic compounds, certain other alkaloids for medicine making are important. But that's not how I practice in my day-to-day practice. So you got to find a version of stuff that gravitates. And sometimes it's just taking some short classes from a bunch of people and see where it resonates with you. Please don't trust AI. And there's some BS out there in books. There are a number of books that are being written. Some of them are doing quite well, that are being written by AI, and they're downright dangerous. And that's one of the reasons I recommend the American Herbalist Guild. You can know that the books that they recommend, the schools that are listed on their website, are actual humans and people with some level of skill and knowledge. And that should be like anybody wanting to delve in the herbalism realm, start there to find other stuff. And if it's within the realm of possibility, do it in person. Like, it's hard to learn depths of herbs without touching them, tasting them, finding them out in your backyard. And that's really hard to do on the internet or through a video. So depending on what state you're in, there's probably an herbalist there that's teaching something. It's super fun. And I do think it's good. I tell my students all the time is like, no, do all the teachers. I am not the holder of all the knowledge. I know some stuff. I've been doing it a long time. I have the poo-poo platter of knowledge and a lot of clinical practice, as do the other folks here. But the reality is, you will hear me rant about how much I love David Winston. He's a friend and a colleague and all that. But we totally will argue about the energetics of a plant. And I'm like, I'm right. No, I'm right. And it's like, find 5 herbalists, you'll find 6 opinions. And it's funny. And then I'm going to shut up. All right, I'm already over time. Whatever. A lot of it depends on your environment. So stinging nettles, we just talked about that for people and cats and everybody else. Stinging nettles here in Florida, it's perfect. We should put it in the city water because here it is, this antihistamine, it's mineralizing, it's nourishing. But if you go out to the desert, you go out on a mountaintop where it's super dry, where it rains twice a year, it's so dry and it will cause constipation. And so the environment that you are, people experience herbs differently, or the person writing the book. I tend towards deficient and a little phlegmy. So I'm going to talk about all the drying herbs because I like that for myself. And I'm I'm not stressed, but I burn the candle at both ends. I'm like doing this on my day off, right? And I got to get up in the morning and teach for all weekend. And then I see patients again on Monday. And so I get a lot of these adaptogen, nourishing herbs. I don't feel that I got a bottle of things that I use for stress, but I'm like, whatever. I literally I love my life. So a teacher who's super hot and phlegmy will have completely different experience from me, who tends to be a little cold and deficient and wet. And so that's based on our own interpretation. So ultimately, I think all the teachers should say, here, taste this. What do you think? And your experience will resonate with you. And so usually by the time my students are done, they start to have opinions, and then I throw their asses out. No, I'm just kidding. Then they graduate. Because it is, we all gain new knowledge. And who was it? I was teaching at AHT conference a couple of years ago, and I was talking about poop. It was all about poop. I think poop's important. And I was talking about yellow dog. And I kind of put it on there as this really powerful poop moving, even though it was great for nourishing iron. And Seven Song, he was so polite. I really love Seven Song. He's a great herbalist, medicine maker, everything else up in upstate New York, and super polite. We've been out canoeing and stuff before and geeking out on plants. And he goes, Bob, I loved your lecture, but I can't get over what you said about yellow dog. And he was being so kind in his approach, because what he really wanted to say is like, I think you're full of shit on that, literally. And he goes, it's not been my experience with yellow dog. It's not like it's this very gentle, nourishing, blood nourishing, iron rich, mineral rich plant. And I was like, and I stopped to think about it. I'm like, you know what? I know what it is. The first time I gave that plant to somebody, they had an adverse reaction and they pooped like a crazy person. And I had one other experience. So in my head, my experience, especially as a newbie, was, got to be careful with this. This is a really crampy, explosive diarrhea kind of herb. So we got to be super gentle. And I never sat there and thought about, wait a second, I'm reading something different. We talk about it for constipation, but it's this gentle, moistening, nourishing for constipation, as opposed to this really irritating, caustic, explosive thing that happened to have been my experience the first time. So I have to constantly check myself as all right, let me look for continuity. Am I biased in my experience on these things? Somebody who hates bitter herbs are going to be like, well, bitter herbs are nasty and positive, or too strong. And we're like, no, we all need some more bitter and sour in our lives. So, yeah.
Anyone in Kansas City, that they can connect with?
I don't have anybody in the top of my head in Kansas City. And I'm going to say you can search by state in the HG website. So you might look for a school there, and you can search that by state as well. If you don't find one, go under the registered herbalist for practitioners and see if there's anybody at least in the state, and then reach out to them. And herbalists generally like other herbalists, not always, but usually. And just maybe email 2 or 3 of the other registered herbalists nearby and say hey, I found you from the AHG website. I'm looking for some schools in the Kansas City area. Have you got any recommendations? And they might be able to hook you up with something that maybe they're not as good at advertising. It's one of those things, if people aren't internet. I know some really good herbalists who literally don't have email. They still have a recorded tape for their answering machine. They don't have a cell phone yet. And so they're great herbalists, and they're just hard to find sometimes. So you got to know somebody sometimes. So I will keep my eyes open. If you join us again, I'll rack my brain when I've kind of depleted my brain cells at this point. So I'm going to leave you all with that. Please check out what we got to offer. We're doing this on the last Friday of every month, the open forum. One of these days I'll make Facebook, but all y'all found us on all the other mediums. We have the last 5 or 6 years of this all archived on the YouTube page. So you can go back and look at all of those and listen to my ramblings and insanity. Totally appropriate to send in questions ahead of time for next month. Subscribe to our newsletter. Follow us on YouTube, Facebook, whatever. So someday I'll make enough viewing hours to make $1 off of this. It hasn't happened yet. So I don't even know how to Instagram works, but good night, all. Have a great weekend.
Let me end this one.
Facebook just.
Hold on, how do we end
crashed
this
on-
one?
Oh yeah, I don't know that one. End stream. There we go.
End stream. Sorry, we've got a bunch we have to end here.